my name is Elie Jarrouge. I'm a 40-year-old man who basically decided at a very young age to become a doctor. And I went through traditional medical training in the US. And I'll get to why I became so passionate about health. I trained in general internal medicine to have the widest reach and impact for people, because then you can address every aspect. I also trained in kidney diseases because I had a particular interest in that. However, I ended up working in the hospital for 9 years. And during that time, all I saw is complications of chronic metabolic diseases. What I mean by that, people with diabetes, heart disease, kidney disease, stroke, I mean, you name it. They come young and old, and it's really sad to see. And all I could do is put Band-Aid on things, treat them temporarily, make them feel better, send them home, and they become like a revolving door coming in and out of the hospital. So during that time, I was also not healthy myself. I managed to gain 35, 40 pounds in my 20s. I developed high blood pressure. I developed pre-diabetes, and I had chronic back pain and back spasms. So by age 30, I wasn't really a picture of health. So I started looking into that, and then discovered that lifestyle and food made me feel better. When I ate bad, I felt bad. When I ate good, I felt better. So I went through something called the Whole30 program, which is like a paleo diet for a month or two. I started losing weight. I started feeling better, better energy, back pain improved, and this light bulb went off. During that time, my blood pressure went away. I started feeling so good, and I was like, okay, there's something about that. Because before I thought, you're destined, your genetics or family history gets you the diseases. And then I started experimenting with myself. I did a keto diet, I did a paleo diet, I did carnivore diet, and fine-tuned things over the years. And I reached the slimmest weight I've ever been since I was a teenager. But it's not all about weight. I also feel younger than ever, feel healthier than ever. I don't have back pain. And then I just couldn't unsee this, and I had to help my patients differently. So my mindset started shifting, and I started advising patients in the hospital about lifestyle and health. And I started noticing change, people who come back and they tell me they implemented it, that they were getting better. And then COVID hit, and I saw who was dying and who was ending up in the ICU. It was people young who are overweight, things like diabetes and high blood pressure. So that became very clear that it's not as simple as, it's just an elevated blood pressure, elevated blood sugar, take a pill for that. You're not really healing. You're just putting Band-Aids on things. And I started coaching. So this is when I started getting active on social media. I had no plan. I just wanted to start helping people, putting the message out there, and got traction. And I started coaching people individually in groups, and take people with diabetes, obesity, high blood pressure, coach them to eat better, and they all lose weight and they come off medication. That was the most amazing thing I've seen. And every patient I see, it's been like Christmas for me. Every time it's so exciting. I mean, taking medications off has been, I think, what a doctor should be, because we're trained as just write a prescription. You go to the doctor, 5 minutes, you have a complaint, then you get a pill, versus diving deep, changing things, and getting people off medication and getting them back to health. You would think a pill will fix things. That's true for an infection and for pneumonia, for something quick. But chronic diseases, there's no pill for that to fix it. It's just kind of managing it. One of the best, what really the pivotal moment, I had this lady who was morbidly obese, who had fatty liver, and her liver was failing. She's not an alcoholic, so it was purely diet for them. But for some reason, I had a good rapport with her, and she was ready for change. She was getting worked up for a liver transplant. that's hundreds of thousands of dollars in medications and really sickness. And I mean, it's not a fun trip. For some reason, she listened to me, and then I didn't hear from her. A few months later, I reached out to the husband, and she basically reversed her liver disease. She's not on a transplant list anymore. Her liver is completely normal by just simply cutting out junk, sugar, refined carbs. So that was like, I knew the magic of word and encouragement, and people who are ready to do the work, they can really transform and reclaim their health. What I tell people, diet is about eating real whole food primarily. It's the most benefit comes from what you stop eating, not what you start eating. So if you continue to eat really bad food, no matter how healthy other stuff you add to it, you're still going to remain unhealthy. So you got to remove the junk, and that could fall into paleo, could fall into keto, could fall into carnivore, depending on the need. So you can tailor this to the person. Some people are more sensitive than others. Somebody with autoimmune diseases, they may have to swing all the way carnivore to eliminate a lot of the stuff to really heal and then reintroduce. Somebody with diabetes, even a piece of fruit will spike their sugar and they can't eat that, versus somebody who's just trying to lose weight, they can find something in the middle. And then as they reach their ideal health, they can find a healthy balance. But obviously, going back to your old lifestyle will bring back all the diseases. So it's a lifestyle change. And I try to move away from names for people so they don't get caught up in those names. Sure. So I take a philosophical approach to health a lot. And I tell people, what health is about, what do you want most? I believe that most of us, good health is a choice as well. Most chronic diseases are dietary disease. And, sometimes you think you're destined and you have it. It's a sentence, you're committed to it, but no, you can reverse it. And then you just have to make steps, and nobody's going to do it for you. So you have to do it by yourself. So number one, you got to decide what you want most in life. Do you want the cookie, or do you want your health? Do you want that burger, junk food, or do you want to, be around for your kids and play and live to a long life? So you really want to decide what you want most in life. Most of us can't get everything we want. So you have to decide, prioritize your life. But I don't know about you. I want my health because if you don't have your health, nothing else matters. If you're sick, when I had chronic back pain, all I cared about is how can I be pain-free? I was in a dark space. I fell down, and nothing else really mattered. But when you don't have pain, you have more time and energy to do other things. So know that what you want most, and I assume if you want your health, that's why you're here on this platform. Then that's half the battle. Number two, you got to picture yourself. I mean, when you're, overweight, you have diabetes, high blood pressure, you feel bad, you feel like it's insurmountable, so many obstacles, it's impossible to change. But you got to picture yourself, who's that ideal you in the future? Lean, healthy, energetic, free of disease, free of medications, and then start behaving. What would that person do? So I tell them, you got to picture that person and start behaving like that person. That person doesn't eat junk food. You don't eat junk food. That person doesn't, doesn't drink alcohol or not much alcohol. Doesn't smoke. That person goes to the gym, works out. Just start eat healthy food. Start behaving like that person. And over time, it's going to happen. Nothing happens overnight. So that's important. Which brings me to point number 3, which is we are a product of our habits and the environment. If your immediate environment is toxic, you're going to make bad choices. And if you're used to making bad choices, you're going to keep making them because you don't think about it. So an alcoholic doesn't hang out at a bar, or they don't have alcohol at home. Same thing. If you know your weakness, you're addicted to sugar, or you just have weakness for something, don't put yourself in that position. Remove it from your home. Ask your family to help you. You really have to change your environment and then make it, build new habits. And it's going to take time. You're going to make them easy and reproducible. And then number 4, you got to keep it simple and actionable. If you have a grand plan that you can't really apply, you're going to fail. Versus if you take it day by day, today, right? Next meal is you're going to decide what you're going to do, what you're not going to do, and then check that mark off, and then you did good, and then you repeat every day. And last point, health requires commitment to start. So if you can't start, you can't finish. But people start, then they stop because they don't have consistency and dedication. So you got to commit to start, and then you want to stay consistent and persist to reach the health you desire. You'll trip up, you'll regress, you'll relapse. It's completely part of the process, but you won't fail if you don't give up. So you're just going to keep getting back at it. So decide who you want to be, what you want most in life. Picture that person, that man, who's there for their family and providing and playing with the kids and living long age. Change your food environment, your habits, keep it simple and actionable, and gotta commit and persist. Well, men, I think, like to feel needed, and then they have a role in the family, and not like being, you gotta make it sound like it's their decision. And you kind of want to tap into their ego a little bit. I mean, I ask them the same question: what do you really want? What do you want in life? What's your ideal life? How do you want your health to be? If they're not healthy, you can ask, how does it feel to have diabetes, to be hurting all the time? What would you do if it's different a little bit? You're just gonna tap and kind of relate to the husband, I guess, make it environment that is judgment free, that is a safe space. It's hard to create that if it's been a rocky relationship, but for you to come here to do this for your husband, you probably care, but how you deliver the message is also important. I mean, men are different, unfortunately. So you gotta tap into, see it from their angle. So providing, maybe making sure to be the head of the family, whatever it taps into, how you want to be around when your kids are growing, see your grandkids. You want to be dependent. The worst thing is when I see old men, not even very old men, they have a stroke, heart attack, whatever, and they're just physically dependent on their spouses, and they feel like a burden, and they're depressed. So, I mean, it's hard for me to say but everybody's different, but you want to tap into that part of the brain. It's never too late. If you're not dead, there's always room for improvement. So even if you had a stroke, you can at least not have a second stroke. If you had a heart attack, you can preserve the rest of your heart. But I've had people with diabetes for 20 years who, after a few months, reverse it, blood pressure, and then never felt as healthy. So I know it's possible. I did it myself. I help people and men do it all the time. And seeing them, so when you got to have faith initially and trust the process, because the first few weeks, you probably don't have a clue what you're doing. And you may actually feel worse before you feel better. So you just have to trust the process, have somebody, accountability buddy, hire a coach, whatever it takes, your spouse, just you gotta stick to it. Give it 90 days at least to really see the other side of it. And then you'll be different. You'll change as a person. You'll see things differently. Coach anywhere in the world. I've had somebody in Australia before, and it was the time zone was interesting, but I did that, and she did great. So I do coach. I'm on social media, on Twitter and Instagram.
Yeah.
Twitter is Elie Jarrouge, MD, the handle, and Instagram, Elie_Jarrouge. I post a lot of, actionable steps. And my website is metabolichealthmd.com. You can even schedule a free discovery call with me if you're interested to know more. I have some information on my website, but if you need my help, I'm happy to coach you along the way.